Okay, without further ado, thank you again for joining us for the Demand Reduction Task Force. This is the first of many series that we're excited to be a part of. I am Bren Journey with Legacy of Hope International, who also will see Nicole Bernard, Pam Strickland, as well as Nikki Miller. They are from different organizations that I'm sure quite a few of you are already familiar with. Nicole was the is the founder of Shield, North Carolina, and Nikki works there as well as assistant director, and as we all know, wears many hats, as we all do, and one of the things that we do. Pam Strickler, the founder of NC Stop Trafficking, and does many things as well. We are all honored to be here today, and that we met, I guess, 2 years ago now, and basically had a chat that we wanted to come together. We wanted to get people together because we realized the importance of demand reduction. And that's how it all started. And it just continues to be an exciting journey as we get to join more people to learn more about this and to also share what we have learned so far. So our mission statement is to create and execute, a comprehensive plan to reduce demand for service of exploited persons. Our vision, a state in which there is no demand for exploited persons. How beautiful would that be? And to be a part of that. And the goal, finally, is to launch effective demand reduction programs to address both labor and sex trafficking based on available evidence and best practices. So without further ado, we're going to jump right in and get things started.
Thank you for that, Bren. So the first thing we wanted to do is give a little bit of context, as Bren just started to do, with where we've come from so far with the Demand Reduction Task Force. And so, as Bren said, once our three organizations got together and we really wanted to tackle the issue of demand reduction, we knew that the three of us, our three organizations, couldn't do it alone, that we needed many other people and organizations and agencies and different professions to jump in so that we could have a comprehensive strategy to address demand reduction. And so we started out doing some general education. We did some couple of webinars, sort of similar to this one. Then we invited every group that we were aware of in North Carolina that was working on human trafficking to join us in an in-person meeting in Raleigh. And so about 30 nonprofits came to that first meeting. And as a result of that, we decided some of our what we referred to at the time as low-hanging fruit, some things we wanted to address, and we formed some teams around those issues. And you'll hear more about teams later. So those teams were working every month. They would get together via Zoom, and we asked them to all come back together earlier this year and in person and to give a report. You know, what have your teams found out about this issue? And where do you think we need to go? And as a result of that, we actually created a couple of more teams. And so we're just excited at how far we've come. And we hope that those of you that are joining us today for this webinar will, if you're not already a part of the task force, will join us and help move us even further forward. So one of the first things that we did was a survey to find out, okay, how many groups in North Carolina are already working on this issue and what are they doing? And so this first slide here shows you that there are 3 groups that were doing something other than general education about the topic. And so you see where those are located. And this next slide, thankfully, a lot more people were doing educational efforts. And you can see that that's fairly well scattered across the state. So what we found out from that survey as well is that there were a lot of groups who wanted to be involved but didn't know what to do. Weren't sure they had the time or the money, but more importantly, weren't sure where to go. So what we're hoping is that a lot of those groups will join in and help us move forward. So I'm going to turn it over now to Nicole, who's going to talk a little bit more in depth about what it is we're trying to accomplish.
Thanks so much, Pam. I'm Nicole. We came together as a group, as Bren and Pam said, and we're really asking a lot of questions about, well, where do we even start? And we realized quickly as we started convening and bringing groups together that we thought we might be using the same language, but we had different kind of nuanced ideas about what demand reduction is, terms like accountability, what was our stance, what lens were we going to look through to evaluate what is demand reduction and what are best practices. And so we quickly realized that we really need to have kind of a document that brings everybody on the same page, so to speak. And so we wrote a white paper. And this white paper is really just to present the case that we need to have demand reduction as a central aspect of anti-human trafficking work in the state. And we wanted to make sure that we were conveying this in a way where everybody was speaking the same language. We wanted to present this to organizations who wanted to join the task force, organizations that were curious about what the task force was about, and then policymakers, decision makers, funders. We wanted to have kind of this document that laid everything out on the table about what we were about. So the goal of the paper was really simple. It was to shift the perception of anti-trafficking work to include demand reduction, because a lot of times we think of demand reduction, we think of anti-trafficking work, and we even forget that there is the other side of the coin, that we have people driving the industry. We also wanted buy-in. We want to bring as many disciplines to the table as we can. We want to address the buyer problem in the most effective way possible. So we were really making the case. We want to increase participation on the Demand Reduction Task Force, and we want individuals, organizations, and system level change for reducing demand across the state. Next slide. So, what has demand reduction looked like historically? Well, when the anti-trafficking movement first got started, it really wasn't much in the picture. Anti-trafficking work was really founded around the idea that it looked like outreach to survivors. It looked like restoration. It looked like prevention, and reducing vulnerabilities and offering restorative services. As anybody who is on the webinar today knows, if you're in this field, those two things can get very tricky really quickly. They can also get really resource heavy really quickly. It's a big lift. And so it's been difficult for us to even really conceptualize of how do we also include demand reduction in this. When we talk about prevention, we've also really focused around reducing vulnerabilities. So things like being unsheltered, being undocumented, having a substance use disorder, all kind of the big ones that we know are vulnerabilities that can put someone at increased risk of exploitation. We've tried to find ways as an anti-trafficking movement to help make the connections about those intersectionalities and reduce those vulnerabilities. System change, we want to make a point of saying, is essential, that we still want prevention to look like reducing vulnerabilities for the following reasons. One, we know that reducing vulnerabilities not only reduces risk of exploitation, but it also reduces risk of other poor outcomes. It provides better choices for sex workers who have few or poor options. But why haven't we been addressing demand? Next slide. I think there are multiple reasons for this. One of them is that when we started the official anti-trafficking movement in the year 2000 with the TVPA, we didn't really focus on demand reduction in that kind of founding document, if you will, that laid out what is human trafficking and defined it with force, fraud, or coercion. And so if we didn't have that be part of the concept, we didn't really know how to move forward with demand reduction. And so we simply didn't. Also sexism. It's sometimes easier to want to come to the aid and support of survivors, as we should well be doing. But we forget sometimes that there are people who are driving this we want to hold accountable. And a lot of times those people who we need to hold accountable are in positions of power. And so it can be easier to serve a survivor rather than kind of stand up to the people who are driving this, who are typically men. And then we have misconceptions around human trafficking. We don't seem to really fully understand what a buyer is. We don't necessarily conceptualize of a buyer as someone who's walking amongst us, people that we love, people who go to church with us, or that we go to work with, or live next door, or who are in our own families. We tend to villainize them and think of them as being people who are lurking in the dark corners, but they have names and faces and we know and love them well. But we don't always necessarily consider them the buyers. And it's hard to recognize that hard truth. And then also lack of resources. We don't necessarily have all the resources that we need to be able to serve victims well and do reduction of vulnerabilities. And there are even fewer resources for combating demand. But also we don't necessarily know what are those best practices. And as the task force kind of quickly came to realize, there aren't best practices, there are promising practices. We don't have this thing figured out yet. So lack of knowledge. So what is demand reduction according to the Demand Reduction Task Force? It's very simply reducing the number of sex and labor acts that current or potential consumers are willing and able to purchase. It's the other side of the coin. It's not the full story, but we're hoping that this will make a significant dent in reducing trafficking at large. What do we know about buyers? Well, we don't know enough. There's still a lot of gaps in the research, but here are some of the trends that we have noticed. Most of them are men, probably not surprising to a lot of people. We know that about 99% of the time that buyers are in fact men. However, I will point out that we just don't have great research that has focused on women. So perhaps that number is deflated. Perhaps it's even bigger. We know that sex buyers have some differences in comparison to average peers and the way that they conceptualize women. They're more likely to objectify women and hold negative views of them. We also understand that for many buyers, they had trauma and especially sexual abuse as children, disproportionate rates of sexual abuse for men who then go on to be buyers. We also know that they're sensitive to rejection, and that some are there for different reasons. Some are there because they enjoy the thrill. Others are there because they want to dominate. They want to control. They want that power. We know that people who can afford it are more likely to purchase. And we also know that sexual orientation was not a predictor. Next slide. So what has the state and beyond done previously to combat demand? Well, arrests. We know that the TIP report, when it came out and it evaluated the United States for how well it's doing with demand reduction, the only thing that it really reported was number of arrests. We tend to think that the buyer problem is an arrestable problem. And that is one strategy, but we don't think it's the full story. We also know that media campaigns to really shift the way the culture is thinking about demand reduction and really hit at those objectification, the way people are thinking about demand reduction, or thinking about purchasing, such as objectifying an individual, really targeting that, deterrence messages for those who are literally calling in and attempting to make a purchase. And then transaction interceptions using technology, such as using chatbots where they're going to get a message on their phone, or even cyber patrols where they call in, they think that they're going to get a young woman who they're attempting to negotiate a transaction with, and instead they're intercepted by somebody on the other line who is well trained to provide some counseling in a sense and provide resources for them to get help. And then educational classes. A lot of times this is known as a John school or a sex buyer school. And then treatment. For some buyers, we know that this is a compulsive behavior. And for some of them, they want to stop, but say that they don't know how to. And so is behavioral treatment an option for them? Next slide. So why a task force? Well, it's a big problem and we want all hands on deck. We want this to be a multidisciplinary strategy, and we want to be able to provide the best and brightest minds across North Carolina to combat this job together. We know that that has always been the best way when it comes to anti-trafficking work. We also know that we need to learn together. there are no best practices right now, only promising practices. So how can we learn those promising practices together? And we also want to make sure that as a state, we're not promoting any kind of strategies that can cause harm. So we want to do this together. We also want to do it to be evidence-based and slowly, so we can make sure that we're not engaging in practices that could inadvertently even increase buying behavior. Next slide. So what lens are we viewing this through? The first is, let me say that we are looking at this through an accountability social justice lens. There are multiple ways that this could be looked at, but this is the lens that we have found to be, according to experts, the most strategic way to be able to address demand. It's based on the idea that sex buying is ultimately a false sense of entitlement over another. It's a power dynamic. It's power over mentality instead of power with mentality. As I stated previously, we know that some sex buyers actually had trauma similar to the survivors. And so how does one person become a victim and one become a buyer and perpetuate the problem? Is it that they are socialized in an environment where they are given that false sense of entitlement, where they have the entitlement to purchase somebody and then do whatever they want? We understand that to be an entitlement issue. We also know that fear and shame and fear of rejection can also drive buyer behavior. So we want to make sure that we are holding accountable, but not increasing buyer shame and fear of rejection, because that may actually increase inadvertently that buying behavior. The shame, the public shaming, is not something that we want to have anything to do with, because evidence suggests that it's not helpful. Fundamentally, though, we know that it is the survivors who are most impacted, and they should be the ones who the buyers are accountable to. And so we want to center survivors' voices in all of the work that we're doing. So understanding the accountability and social justice lens has really helped us define all of the teams and the goals for those teams through those lenses. And Nikki Miller is going to talk about that next.
Thanks, Nicole. So, as mentioned, the Demand Reduction Task Force is made up of several different teams. And as I review these teams, if you recognize that you have an expertise in an area and would like to get more information, or would like to serve on the team, I would encourage you to go to the Demand Reduction Task Force website. I just dropped that in the chat, and it'll also be up on your screen at the end. But we have a list of the teams along with the team leaders and their contact information. So you can contact the team leaders, or you're welcome to contact any of the four of us, and we can make an introduction if you'd rather do that. So each team meets virtually every month. And then all the teams together meet in person as a whole a few times a year. And the teams do a lot of collaboration, as you'll see as I go through, which is very important that they collaborate. So let's jump right in. The data team collection, or the data collection team, is identified to reflect the scope of the problem of buyers and the level of demand for purchasing sex and labor acts. We want to gauge those. On these slides, you'll see at the top is the goal, and this is the goal of the task force as defined through the accountability social justice lens that Nicole was just talking about. So the data collection team retrieves data that will inform effective strategies for the rest of the teams on the task force. We want to know the number of arrests, the prosecutions, convictions, and the discrepancies between the charges and the prosecution. Are they getting arrested but not prosecuted? Or they just get a slap on the wrist and let go. We also want to identify for North Carolina the scope and nature of the problem. One thing we do is we look at other states to see what other states are successfully doing, because there's so little, we're pioneering this, so there's so little concrete evidence of what works, especially for North Carolina. So we look at other states to see what has worked for them. But we want to identify the scope and nature of the problem here in North Carolina. If what works in Texas may not work here. So we want to know for North Carolina, the buyer demographics, how many buyers, how often do they purchase, and how many ads for sex exist in North Carolina. And then of course, when we collect this data, we share it with the other teams to inform their strategies. Next slide. All right, and there's also an awareness and media engagement team. As Nicole mentioned, is very important to shift the way people think about human trafficking. Instead of saying, you know, a victim was raped 10 times a day, we need to think, okay, well, who's raping this victim 10 times a day? You know, we want to shift that and put some of the emphasis back on the buyers who are driving this problem. So on the media, the awareness and media engagement team, they decide how to best educate and engage the public, identify effective methods used in other states, as I mentioned, and then after doing the research and putting all this together, create and launch an effective media campaign. And then identify, we found that these media campaigns are very expensive. So in working with the awareness and media engagement team, we're identifying and pursuing funding opportunities. Next slide. All right, and then there's the treatment team. Arrest is not our end goal. Our end goal is to see purchasers whole and healthy and able to not purchase again. So we have developed a treatment team, and they are determining the best practices, identify those who need treatment, a best practice in assessing those, what level are they, do they feel like it's just the rite of passage, or are they compulsively buying? Is this a first-time buyer that's curious, or are they visiting hobby boards and have a real problem? So that we want to find the best practices in assessment, and then also best practices in treatment. We've been doing a lot of looking into and trying to find out, do we treat, you know, the buyers as sex offenders? Are they sex offenders? Are they all, can they all be considered sex offenders? And that would go back to the best practices in assessment. How do we assess to know the level of treatment? Would a John school help? Those types of things will be determined by the treatment team. Next slide. Also, anti-pornography team. We know that pornography feeds into the problem. So we have an active anti-pornography team. They support the other task force teams by reviewing and communicating the pornography research that's applicable to that specific team. They also research effective approaches used by other states to communicate the effects of pornography, especially the effect it has on demand, and then communicate those to the rest of the task force members, and then determine ways to reduce the access of porn to minors, and hopefully find an effective way to do that. We are hoping to create, if any of you guys have expertise, please reach out to us. We have a couple of very qualified people that have recently reached out. So we are developing this new team on policy and legislation. The policy and legislation team will identify the state policy and legislation that needs to be changed, created, or strengthened, and also advocate for the creation, you know, of these changes, or the creation or change of these policies. And the data team can really speak into that policy and legislation by finding, you know, as I mentioned, are people, do we have strong policies on the books and they're just not getting enforced? Then that would go, you know, to our law enforcement team to do the trainings to train the law enforcement professional to how important this is, or do we just not have very strong policies? So you can see how these teams collaborate and work together. Right, next slide. and labor trafficking team. This is something we really want, we feel strongly that needs to be developed. This has been started. Unfortunately, the really strong members of this team were pulled away to work on other things in their own jobs. So we would like to get this back up and running. Of course, labor trafficking in North Carolina, it depends on who you ask, but some people believe the labor trafficking is even more of a problem than sex trafficking. So this is a very important team that we'd like to get up and running. So please reach out to us if you are have the expertise in that. And they just, they would do awareness and education campaigns with the municipal governments, corporations, and general public to bring awareness to the problem. All right, our law enforcement engagement team. Next, we'll have Pam talk about what they've been up to. We've had some exciting successes come out of this team. They pursue law enforcement engagement because without law enforcement, then our efforts will not be as effective. As you know, part of it is arrest that sometimes spurs the treatment and gets the attention. So we absolutely need to have engaged the law enforcement professionals. They encourage the development of the data collection and reporting system between all divisions of law enforcement so that all divisions of law enforcement can talk to each other and know what's going on across the state. And then the last thing we've asked them to do is advocate for the training of law enforcement on the role that demand plays in human trafficking, which is what we just did in September. So Pam, you want to tell us about that?
I would love to. So the law enforcement engagement team has been pretty busy. What we did last month was have a conference, a training session for law enforcement specifically. We did it in conjunction with the Human Trafficking Commission's conference that was in Raleigh. So we did it the day before that, hoping that folks would be planning on coming to Raleigh anyway and just stay an extra day perhaps. We had two amazing trainers. The National Center on Sexual Exploitation made available to us one of their staff members, Dr. Stephanie Powell, who is a retired vice sergeant with the LAPD. So she was able to give some interesting perspective on work that she had done there. And then we had our North Carolina's own Rick Hoffman, who retired from the Raleigh PD as a major and as the person who coordinated their human trafficking efforts there. And they were both just amazing. Well, excuse me, I wanted to give you an idea of the quality of the people that we had there, a wide variety of law enforcement positions, lots of detectives and investigators, which was great, but also some chiefs of police and captains. And I mean, you can just see the different types of staff members that we had. So we're very pleased with that, to have such a wide array. And a very wide array of different law enforcement agencies. We had 22 sheriff's offices represented. We had about 11 police departments, and then several military offices, as you can see here. So this makes it a little bit easier to see kind of where they're spread out. Of course, it's concentrated in the central part of the state because the training was in Raleigh, but we did have folks come from the coast and a couple come from the pretty far west as well. So we were pleased with the vast diversity of the law enforcement that we had there. So I wanted to share this quote from one of our speakers. It's our hope and motivation that law enforcement and society will look at sex buyers with a different lens. And we did a pre and a post survey and an evaluation from the training, but I wanted you all to see this, how many of the officers who were there would like even more training on this topic. And so our team is already talking about how to make that happen next year. So I'll just give you a second. You can read these quotes that are from the evaluations. In addition to the 2 trainers that I just spoke about, we also had a survivor who was a part of it, who, you know, just shared her story and her heart with the law enforcement officers there. And I think that's always such a positive thing to do with any group that you're training. But especially with law enforcement, I think it can help develop empathy. So just a couple of more quotes from our evals. And oops, sorry. I am going to switch over now. So if you're interested in being a part of the law enforcement engagement team, we would love to have you. As Nikki said, if you will just go to to our website, and you'll see the team facilitator there, and just shoot them an email and let them know. I'm going to turn it over to Nicole now to tell us about the curricula team.
Thanks so much, Pam. All right, I'm back. So we want to make sure that organizations who want to start including demand reduction in their educational materials, that we as a task force are identifying what elements do they need to include for it to be one of those promising practices. What is essential to communicate in combating demand in your presentations. And we know that through the survey that we submitted almost 2 years ago, that there are organizations who are already doing this. We know that some organizations, for example, are including demand reduction in their HT 101, which is fantastic, but we don't necessarily know that they're including the right information, the information that is considered to be the most important, the most effective information to convey to potential buyers or current buyers. And so that's what the curricula team is all about. We want to make sure that we have identified curricula that might already be out there and really bring it to the table so people have an opportunity to review for themselves what might work for their organization and their organization's needs. But we also want to make sure that if you already have curricula, that you are provided with standards and what are those elements for best practice or emerging promising practices. We want to make sure that this is available for presentations and education that is being given to both adults and to children. We want to include it for children because we want to make sure that we are providing the right kind of messaging to prevent buying behavior before it even starts. And for the many adults who are considering purchasing and who say that if the time is right and if the circumstances were right, that they would be buying, that they would think again. And we also want to make sure that anybody who has bought in the past or is currently actively a buyer, that we are giving them the right kind of information so that they would start second guessing those decisions and so that they understand the harm and that they would choose differently. However, we also know that some of the material that we're coming across is going to be better provided to the treatment team. We understand that education alone is not going to be prevention for some individuals, particularly those compulsive buyers who say they want to quit but don't know how to quit. They may understand the harm, they may understand the full picture, but because it's a behavioral issue, they may need a specific treatment. And so any of that information we're going to hand over to our friends on the treatment team. We also want to make sure that we are developing lessons to supplement the mandated middle school and high school human trafficking education. So if you're not aware, North Carolina has mandated that schools do provide human trafficking information to students in middle and high school, but not always are they including demand reduction. And just numbers wise, we know statistically that in one classroom that there are probably going to be significantly more buyers in the future than there would be victims. So we want to make sure that we're addressing both sides of that coin. We want to make sure that we are creating trainings for professions or groups that would most benefit from demand reduction trainings, such as media engagement and law enforcement engagement teams. We want to create a curriculum to educate the public on the dangers of pornography and the link between pornography and demand. And we want to create demand reduction specific trainings and slides for public or anti-trafficking organizations, which is really what we're currently very focused on. And the way that we're doing that is pretty simple. We're looking through the literature. So we've done a lit review. Surprise, surprise, there wasn't a whole lot out there, but we gathered what we could. And then we're also just going to the experts, and we've cast a wide net. The demand reduction movement is small. It's pretty nascent. And so it's easy to find those experts. And so we are setting up kind of structured interviews, transcribing their pearls of wisdom that they're giving to us in those interviews, and looking for trends that we can then convey to others in educating others who want to educate the public on demand reduction. So if you are interested in joining this team, we would love to have you. Please let me know. I think Nikki has put information in the chat for the demand reduction website, and you can find my information right there. All right, that's me. Oh, I've already done that one, so sorry.
Okay, well, that was a lot of information. So I think everyone that we have like almost 50 people that have jumped in, and we are so excited. As you can tell, we need you. And so a lot of you were already learning and working together as well. So that is exciting. So please feel free. It looks like we've got some questions coming in. So that is where we're at. While we're waiting for a couple more questions to come in, then I'm going to review again just what our mission, vision, and goal statement is. If you hadn't pulled up the website, please feel free to do that. That might even help, think of some questions or answer some questions that you have. So our mission is to create and execute a comprehensive plan to reduce demand services of exploited persons. Our vision, a state in which there is no demand for exploited persons, and the ultimate goal to launch effective demand reduction programs to address both labor and sex trafficking based on available evidence and best practices. And as you can see, that is where we're at, as we really need to get that evidence and best practices so we can meet the needs and make a difference. It looks like Kara Griffin actually put some information on here that I'll share. It says the U.S. Department of Education provides a free school guideline online. So thank you. Yep. Since 2021, updated training manual to identify and prevent child trafficking, which obviously is very important, very thankful. There's a lot of work that's come a long ways over the last 20 some years, and the government has done an excellent job in providing those tools. So thank you. And we'll share that link as well in just a few minutes. So thank you, Kara, for sharing that. So to jump in, and because I want to make sure I don't miss any questions. So let me pull this up real quick. It looks like one of the first questions that we have is based on Nikki. If you can share again, just real quick, which teams currently are needing the most help that we're looking to kind of recruit people with expertise or just have the passion, and what that might be.
I would say the treatment team. We would love that to be led by someone providing treatment currently, either as a sex offender counselor or people that work with any type of sex addiction. We would invite them, or anyone providing treatment is welcome. And also, as I mentioned, the labor trafficking team. Unfortunately, like I said, we had some really strong people in that team that got pulled in to some other projects that they were working on. So unfortunately, there's no one there, and that's very important. So labor trafficking and treatment jump out at me, but we could use, help in any team that you might have expertise or knowledge about. Would you guys, Bren or Nicole, would you guys add anything else?
I would mention that policy and legislation team is new. And so we could
Yes.
certainly use some additional help there.
I felt like I was missing one. Yes, policy and legislation.
And I am biased. I definitely say the treatment team. So, but yeah, we thank everyone and definitely know that.
You know what we would love to do, and I feel like it's something anybody could help with, is gathering research. We really want to be as evidence-based as we can be, and we don't want to just fly by the seat of our pants. These are, human beings, that we're affecting. So we want to do what we know works. So anyone interested in doing research, and I could talk more about that, but there might be other questions.
And I would like to piggyback on that, and definitely we are always more than welcome. This is what this is all about, and it has to be led, as always, by survivors. So any survivors that want to come in on either side of the table, that please share this with people that if you aren't listening yourself and are a survivor on either side. We would love to chat with you. We'd love to learn, because that's what we can't do it. That's what this is all about, is healing, right? And prevention. So the other question that we have, Nicole, is more directed at you, and looks like they're curious about how you got your research so far, like specifically from the white paper, when you're talking about what data is missing, what data you found. Where did the research you do have, where did that come from?
We just did a basic lit review of peer-reviewed journals. So that was our criteria. We started out looking at things that were new and found very little. So we pushed back the years a little bit more and more and more. And I believe I have the notes, but I think we've gone back about a decade, but really tried to focus more on prioritizing those that were more recent research publications. But I will say one of the barriers that we ran into is the terminology. So when we were looking at sex buying, unfortunately, that was conflated with sex offense. And sometimes that's one and the same, and sometimes that looks really, really different. And so we kind of pivoted and took a harder look at what kind of assessments are out there, because we were kind of getting pointed in the direction based on the research that there are buyers there for a variety of reasons. And so really being able to do good assessment is going to be key. We had a clinical psychologist that has helped us kind of make sure that we were doing a lit review using best practices. And so we kind of just pieced together when we started asking good research questions and couldn't find it in the literature because it was conflated with sex offense. We just started noting that those were things that people need to start researching more of. We've also really looked at experts and taken a lot of guidance from them, and there's just a handful of them. So we've really tried to lean into whatever they say and whatever wisdom that they have earned in the work that they've been doing.
And just to piggyback on that, are you referring to experts that we're already working with here in North Carolina or other states?
We really had to cast a wide net because here in North Carolina, there aren't any organizations that we know of that are solely focused on demand reduction. Now, A Call to Men does really, really excellent work, and we love and respect the work that they're doing. It is, and it covers, there's some overlap with demand reduction, but that's not the only scope of their work. Outside of North Carolina and in COSI, they have had some good work being done. We also, Nikki, I'm going to ask you to jump in as well, because I always seem to forget the names. There's another group that was originally called Demand Abolition. And so they had done some kind of pioneering data collection, and now they have become in COSI. So we relied on them. The EPIC project is another good one that we have asked questions to. Shared Hope International has some good expertise. We've, on the curricula team, we've really had the honor and privilege of working with a survivor and a former buyer. So that has really been very helpful. And then also Texas, they have a, it's called CSAT. It's the court specialized, someone help me. The treatment board, the court's specified treatment board, I believe.
I think it's sex offender treatment.
Yes, thank you. Sex Offender Treatment Board. And that was probably a good example of a program that has really conflated sex buying with sex offenders, but we were able to get some good information from them. So kind of, as you can see, we've had to kind of get what we can get from the few organizations that are out there. And I think that the few organizations that were out there, I think I could probably represent them well by saying that nobody has it figured out. So we're kind of all learning this together.
Thank you. Yeah.
Bren, I did want to mention a few of those experts that we've been talking to will be on the fourth session in the webinar series at 2:00 on November 30th. And I'm really excited to hear them speak. I'm not going to try to say his last name, Peter Q. Anybody want to help me with the last name? Polyatine. Yes. Nick Limbo. Stephanie Powell. And was it just those three? Am I missing someone?
Did you say Michael Shively?
I did not say Michael Shively. Yeah. So that would be a great one if you're interested in hearing from the nationwide experts.
Yeah, we'll touch on that in just a few minutes. Yeah, I'm so glad, because if someone has to leave a little early, then they know they need to check into every Wednesday of this month. We have more, and it's not going to be us. It'll be more exciting. No, I think we're good, but no, I'm just joking, giving a hard time. So yeah, a lot of good experts that have taken the time just to volunteer their time, and it's just a beautiful thing to be a part of. So we do have Dr. Jim Duncan, who has a question, and I'm going to let any of y'all respond to this. I guess we'll start maybe with Pam, and then whoever else wants to go from there. We need more men involved in this battle. I think we can agree with that. How can we get more males involved in this fight? It is a man's problem that the women have taken upon themselves to reduce demand.
Jim, from your lips to God's ears. I mean, we totally agree, and it's almost a joke, and it's not funny at all. But whenever we go to any kind of a human trafficking conference, who's always the men are always the minority there. And I agree with you completely that it's a men's issue. It really frustrates me when it gets lumped into as a women's issue with some other things. And I'm not sure. I really feel like it needs to be men holding other men accountable. Because when it comes from us, I think so often it comes off as, nagging, or, that type of something that they're not as likely to pay attention to. So I think one thing that might help is if we had, for instance, male pastors who would be willing to actually talk about it, if not from the pulpit, then at least in, smaller like men's groups and that kind of thing at churches. But to have men hold other men accountable. But if you have suggestions, please share them.
I know that's okay. Go ahead. No, go ahead, Nicole.
You're probably going to say the same thing, Nikki. So you go ahead.
Well, I was going to say, I know that's one thing we were looking at the awareness and media campaign on that team. Who do we target with this campaign? And we decided first of all, we looked at targeting, men. And then we thought, well, let's even go upstream a little bit more, and let's target younger boys, young men, and just do some education, teach them how to view women, teach them that you're not doing them a favor by giving them money. This is not somewhere they want to be. Or what are some of the other lies? It's me getting my needs met. That ideology, we really have to battle. So I think it's education as far as how we get more males in the fight, which is a long road to switch that viewpoint. But it's something I think we're all doing. Is trying to educate and get the word out a little more, and just shift that cultural view, and instead of just accepting it as a fact, is actually changing that.
I also want to point out that, and if it hasn't been conveyed, I want to reiterate it here, that we do believe in restorative justice. We don't believe in at throwing the book at someone and that everybody just deserves punishment. We certainly don't think that that's going to solve the problem, although we do believe that some sort of punitive action is part of justice. We don't think it's the full solution. Each of the panelists today is raising sons. It has been my experience as a mother that I've seen kind of secondhand the messages, the very confusing messages that are coming at our young men. Things, oftentimes masculinity is defined as not being feminine. And then we tell our young boys that the way to really find value in society is through having power over. So I think that there's a certain amount of compassion from the panelists that I'm hoping will extend throughout the task force, which is that we aren't man-hating women who want to condemn men. What we want to do is really combat the mixed messaging and the very unhealthy messaging that our young people are receiving that can lead to bad ways of thinking, that can lead to exploitative behavior. SHIELD has certainly recognized kind of the trouble with having us not have a man represent SHIELD on the task force. And so we are looking to hire someone, and we're having trouble finding a man that we can hire. So if you know of someone, please let us know. But we have been very selective in the language that we use, and we are very receptive to input about not using terms like toxic masculinity, for example. And sometimes we may use those terms because we are all women. We've been socialized as women. We don't necessarily know the questions to ask. And so there's a learning curve for us as well. But I hope that we can convey that we're very much willing to learn, and that we really want to have men at the table, not to condemn or point fingers, but to partner with, because we do believe that men really do have the power and really more of the insight to be able to end in demand. And so we want to welcome them.
Yeah, and all of that, and I think all of us would agree too that we've seen those that have been in the fight of anti-trafficking, anti-abuse, we've seen a lot of growth actually when it comes to men standing up, but they're still in the minority. And evidence is even showing, since we're talking specifically about the gender of male, the reason we're talking about the gender of male is because that is what evidence is showing that is driving the demand. So I want to make sure that that's very clear, because we know everyone is involved and anyone can be a victim. So I want to make sure that we communicate that as well. And it's been great to see many different people be a part of this task force, men, women, they, he, she, I mean, everyone is a part of this. There is no gender that is can't be a part of this, and we are inclusive, because you can't be, you can't not be. And I think we know that in our society, and hopefully continue to learn and encourage each other that way. And we see a lot of groups. In fact, if you decide this is something you want to be a part of, and you need to be a part of because of your experience, you will see that there are quite a few men that have stepped forward and are taking the lead and in doing their own thing, as well as being part of the task force. So thank you so much, Dr. Jim, for that and pointing that out. It looks like we've got a couple more questions I want to make sure we get to. I think we're okay with time. So Pam, the next one is for you. And basically it's about the law enforcement section. So just curious about what law enforcement is currently involved in the task force, and are we still open? Is that one of them, that even though there's a lot going on, that it's still open to needing or wanting more people to be involved with, and how?
Definitely. Yes. So we have Dr. Jim Duncan is actually a member of the law enforcement engagement team, and he is a former military. We have a retired law enforcement officer from Florida. We would like to have more active law enforcement on our team, and we had several people after the training in Raleigh who indicated they wanted to be a part of the team. So we were very excited about that they found value in what the team was doing and wanted to be a part of it. So we're excited about that. I thought, as I've been listening a little bit here, I thought since we've got a couple of minutes that I might share some of the issues that the law enforcement team is dealing with, because it might seem like it's really cut and dry in terms of what we would be asking of law enforcement, go arrest the bad guys, right? Which, as Nicole has said, these they're not all bad guys. They're people that we know and go to church with and live with and our neighbors up and that kind of thing. But even that's not as easy as it might sound. So one of the things that probably our legislative team, legislation and policy team will be looking at is the actual statute that the charge for solicitation. Currently, that causes some issues in terms of data collection, because right now the charge for solicitation applies both to the person selling sex, the prostituted person, as well as the buyer. So they can both be charged with that same charge. It's a misdemeanor. And so one issue is that we don't have good data on who's doing the buying, because the buyers and the victims are tied, are being charged with the same thing. The other problem is that it is a misdemeanor. And, if we talk about running a reverse sting operation, which is the best way that we know of currently in terms of law enforcement operation to get at sex buyers, we find that it is just a misdemeanor, and that takes a lot of time. Those operations take a lot of personnel and take a lot of time. And so sometimes they just simply can't afford the resources to spend on something that is just a misdemeanor, right? And that when it gets to the DA, may in fact get dismissed or get charged with something even less than that. Unfortunately, many of our DAs don't take that charge seriously. Our judges don't take that seriously. So the law enforcement team is having to deal with all of that, all right, with a law that is a statute that is not clear, with a very low level charge of a misdemeanor that many law enforcement agencies may not want to spend their resources chasing. And also they don't want to chase it because experience has told them that it gets dismissed a lot. So we need to be educating. We may need to advocate to have the statute itself changed. We need to advocate to our DAs and our judges that this is something worth prosecuting. This is something worth having a consequence for. So we're dealing with all of those things. And if we go back to the law enforcement, on the ground level, there's still a mentality among a lot of people that this isn't something that people should be charged with anyway, right? That boys will be boys and it's a consensual transaction. Why it's none of our business to go after it. And so one of the things that I found as I do trainings with law enforcement is that many law enforcement officers and superiors as well don't think they have sex trafficking in their jurisdiction, and will say, oh yeah, well, we've got some prostitution, but we don't have any sex trafficking. And so trying to educate them to the fact that if you've got prostitution, you almost certainly have sex trafficking, and how to identify a victim of sex trafficking. So we aren't necessarily able to start with the demand reduction piece. Sometimes we have to go all the way back to what exactly is human trafficking versus prostitution. And when they invariably say, and this isn't just law enforcement, this is a lot of the general public as well, will say, well, this person made that choice to be selling sex, and have to kind of go through some explanation of, it's not a choice if you don't have choices. So anyway, I thought I would just share some of that, because it might seem like, oh, well, all we need to do is explain to law enforcement how to do one of these things, and boom, we're going to have this problem solved. We're having to deal with a lot of nuances and a lot of mindset. It's a pretty major mindset change. And in fact, I had an officer say to me during a training about 2 weeks ago, he said, this is just a new idea to me. And that he was looking around to his colleagues and they were all nodding. Yeah. Like, what are you talking about that these prostitutes, somebody else might be behind it, so that, and he said, look, I just need some time to process this. I got to wrap my brain around this. So we're 22 years in to this movement, and we've still got people in positions of authority who don't understand what it is. So I didn't say all that to be discouraging. I said all that to be informative, that these are the things that we're having to deal with as we want to move forward in trying to create a comprehensive strategy for our state, and knowing that law enforcement and the court system most likely needs to be a big part of that. We still have a lot of education left to do.
That goes to your point, Pam, where you mentioned earlier how important it is to kind of follow the lead of survivors and have survivors speaking at the law enforcement training, to have them do some education of law enforcement. It's so important that we have that survivor input and be survivor led and ask survivors, what would you have law enforcement know? And I think it was very powerful when we had the survivors speak at the training in September. I think even a lot of the officers made comments on their evaluation that it really helped them understand the problem.
Yeah, and with that being said, it looks like we've gotten in what looks like there might be another question that just popped up just as I thought. Let's see. I'm not going to share the name just in case. I'm not sure if everybody can see the questions, but this person says, I am a survivor and would love to help and provide input and feedback and when and if needed. So wonderful. So we will make sure that we reach out to you and personally the task force will. And also feel free to email us, and we'll put a couple of our emails in the actual chat box, so you can reach out to us. And looks like Nicole might be writing a note as well. So with that being said, thank you, everyone. I want to make sure that you understand every Wednesday we're having a training, different people coming together with expertise. So next Wednesday is November 9th. Session 2, a survivor's perspective. And that's going to be with Autumn Alley and Melissa Elliott, both survivors, both professionals in the world, that have just shared so much and doing so much to help people. And we are thankful so much for their time to join us on the 2nd. So make sure that you go on the link that you received already from joining this one, and share it with others. Please be sharing on your social media, LinkedIn, in different ways, and emailing, newsletters, however, texting personally, because this is one of the ways that we fight it. This is the way we prevent it. We've got to come together. So that's next Wednesday, the 9th at 2 o'clock. Then the following Wednesday, we're doing Recovery as Possible, session 3, and that's November 16th. And that is going to be just as exciting. And, feel free to look up more information again on our website. Session 4 is Putting It All Together, Wednesday, November 30th at 2 o'clock to 3:30. And so once again, thank you so much for joining us. The website is ncdemandreduction.com. So jump on there, and please reach out to us personally with any questions or thought that maybe you weren't comfortable sharing here. We definitely have a lot to learn together. So thank you. With that being said, thank you for joining us, and your expertise is needed, as you can tell. With our mission and vision, you can be a part of it to create and execute a comprehensive plan to reduce demand for service of exploited persons. So just imagine how you can be a part of making our state safer to end the demand. Have a wonderful day, and thank you so much for joining us.